We start with the probe in the transverse orientation over the posterior midline. The anatomy of this patient is actually so clear that we can identify the posterior complex, intrathecal space, and anterior complex. From this position, we'll move laterally and tilt back towards the neuraxis to identify the transverse process. We can identify the quadratus lumborum muscle attaching to the transverse process sort of like a hammock. The brighter psoas muscle lies anterior to the quadratus lumborum muscle, and our target for the anterior quadratus lumborum block is the fascial plane between these two muscles. Now that we've correctly identified the quadratus lumborum muscle by its attachment to the transverse process, we'll fan the probe slightly cephalad or caudad to clear the transverse process from our needle path. We'll advance the needle in a posterior to anterior direction using hydrodissection to identify the fascial plane. Once we've identified the correct fascial plane, we'll administer our local anesthetic, and this will spread in a cephalocaudal direction from approximately T6-7 to L1-L2. After our block is complete, we can visualize this cephalocaudal spread by placing our probe in the sagittal orientation over the iliac crest and scanning cephalad.